Okay, everyone, in order to be respectful of everyone's time and to get through our packed agenda this morning, we are going to get started. Um, my name is Kate Bohannon. I'm an education consultant for the Connecticut State Department of Education, and I'm going to hand it over to my division director, John Frasinelli, for some opening remarks.
Thank you, Kate. Good morning, everyone. Thanks for joining us this morning. We have had, I believe, what amounts to a record number of folks registering for this, I think close to 500 at this point, which just goes to show you that we all have a role to play in ensuring regular and consistent attendance of our students, regardless of whether that's your responsibility in the school or you are a social worker, school counselor, administrator. This work requires all of us to be working together. So thank you for recognizing that, and thank you for joining us this morning. And on behalf of Commissioner Charlene Russell Tucker, we appreciate your time and appreciate all of the work that you do really to support our students, not just through attendance, but their social, emotional, and academic success as well. So thanks for joining us. And I want to also acknowledge who is our guru when it comes to all things chronic absence and attendance. And also want to welcome and thank our partners from Attendance Works, Elliott and Emma, for joining us this morning as well. So with that, I will turn it back over to you, Kate. Thanks.
All right, thank you, John. So as I mentioned before, my name is Kate Bohannon, and I'm a consultant for the Department of Education. A couple housekeeping pieces. So cameras and microphones are disabled. We've got a large group with us here today, so please use the chat or Q&A function. The webinar is being recorded, and the recording and slides will be shared with everybody who registered. That may not come out until next week, but it will be coming. Also, please be mindful of confidentiality. We want you to be able to ask questions, but also know that this is being recorded. We do have a very large audience, so be mindful of any identifying information. And if you are having technical issues during the presentation, please reach out to me. It may take me a minute to respond. I'm doing a couple different duties here, but I will get back to that as soon as I can. So I'm really excited for this series. Before I worked at the State Department of Ed, I was a school social worker for over a decade. And I know firsthand how hard it can be to seek out professional learning when there's a line of students at your door, a stack of IEPs or 504s to write, and it's been your goal all week to actually get a lunch break. So this student support series was born out of that need. And the registration and attendance today shows just how large of a need this is. With this series, we hope to provide you with the knowledge, skills, and resources you need to best support your students and families. So now I'm going to hand it off to my colleague, Kari Sullivan-Custer, to get us started.
Do you want to do
this? Sorry. Oh, I'm so sorry. I forgot. I had one more slide. So one more housekeeping piece, the continuing education credits. So this webinar has been approved for 1.5 continuing education credits by the National Association of Social Workers. This also meets continuing education criteria for Connecticut LMSWs, LMFTs, LPCs, and licensed psychologists. I have gotten some questions about nurses. The NASW Connecticut is not cross-endorsed for nurse continuing education credits. You are welcome to reach out to the CNA and ask them if they would approve this. If so, please send me an email and we can get you a certificate. So to be eligible to receive free CECs from this program, you must meet all of the following criteria. Hold one of the licenses I mentioned before. You must be an employee of a public school district, which includes charters, magnets, and CTECs. Private school, special education school, or alternative education program. You need to attend this webinar live and miss no more than 15 minutes. Watching this asynchronously later, it is not eligible for CECs. And then there will be a CEC request form that will be shared out with you after the presentation. All right, now I will hand it over to Kari.
Okay, great. Thank you, Kate. Can you hear me okay, everyone? Yes? Okay, great. I wanted to stop in today and introduce myself. If you don't know me already, I'm Kari Sullivan-Custer. I'm in the Office of Student Supports, and I am the state lead for attendance and engagement. I've been with the State Department of Education now for many, many years and have been working on attendance engagement for about 10 years. So we've been doing this work for a long time in Connecticut around chronic absence, reducing chronic absence. I think we were one of the first in the nation to actually report chronic absence data publicly and to include it on our accountability systems. So I always start with the data, and that today's no different. So because we have the experts here today, national experts on attendance and engagement, I'm just going to really make you aware of what's available in Connecticut and share some of the data to sort of level set everyone. How are we doing in chronic absence in Connecticut? So this first slide is our Connecticut Education's landscape slide, and it gives the numbers of our profile of students. We have 508,402 students in Connecticut. That number will be updated with the October 1 counts, but as of right now, that is our count. A majority of our students are students of color. And you can see here, 45.1% are white students, 44.8% are eligible for reduced lunch, 18.5% with disabilities, and 11.3% are English learners. And we look at our data for all of those groups, you'll see in a few minutes. And it breaks down here the numbers of school districts. We have 202 school districts and 1,500 schools, the number of staff, and the percentage of teachers of color, which is growing, and there's a lot of effort to grow that number as well. And to the right is chronic absence rates, and you'll see before the pandemic, we were, around 10%, 9%, and then we started to grow when the pandemic started, peaking at 23.7%, and we've reduced our chronic absence for 3 years in a row, finishing last year at 17.2%. Next slide, please. This is our chronic absence trend looking at our high need students. Our high need students are those students who are English learners identified for special ed or free and reduced lunch. And you'll see that the pattern is parallel, that we're seeing reduction in chronic absent across both groups, and even the high need students is a little bit faster reduction than our non-high need students. We have a long way to go. Our goal is to reduce our chronic absence by half of 23.7 by 2028, I believe. So what this means is that there are now 34,000 more students attending school regularly in 2024-25 compared to the height of the pandemic. However, there's still 83,000 plus students chronically absent last year, which is too many. Next slide, please. I wanted to share here our Connecticut resources. I'm not going to go through all of here, but over here on the right is a QR code and a link to the chronic absence webpage. And on that webpage, you'll find the definition of student absence, which was updated in the last several years. You'll find data portals, both the public EdSite data portal and on the EdSite Secure, where you can look at student-specific data and school district data in more detail. And all of these are there. I want to call attention to a couple of them. We have this Reducing Chronic Absence in Connecticut Schools, which is our guidance document. The Learner Engagement and Attendance Program is our research-based home visiting model where we offer training every month for home visits. It's virtual in 2 hours, and everybody's welcome to come to this 2-hour virtual home visitor training. And Talk Tuesdays is our community of practice that meets 2 times a month. And these links are all live, and you'll be able to find the registration for that too. We also have our attendance awareness campaign, School is Better with You, and that link is here too with lots of resources that you can download and use for handouts to families and staff. So with that, I think I'm handing it back to Kate. Oh, no, I'm not. I have to talk about the law. I'm sorry. So many of you probably know that since around 2015, we've had a law that any district with a 10% or higher chronic absence rate, or with at least one school with a 15% or higher, is required to have a district attendance team. That law is linked here so you can review it. And schools with a chronic absence rate of over 15% are required to have a school attendance team. This year, there was a new public act that got passed that will require the State Department to provide an annual update to the Juvenile Justice and Policy Oversight Committee, which just means that we're going to be collecting more information from alliance districts on what your teams are doing for this annual report. And so if you're at an alliance district and you're on the district attendance team, be prepared so that we can collect this information through your alliance district application. Okay, thank you, Kate.
And now I welcome our colleagues from Attendance Works.
Thanks so much, Kate, and thanks for having us. We are glad to continue to partner with CSDE and your community of practice, and really glad to have this opportunity to engage with you in conversation today. And so we hope that our interactions are engaging, and we invite you to respond in chat as we prompt you to the questions that are following. So let's take a look at why attendance is so important and it's such a priority in the state of Connecticut. So let's go to the next slide. Here's what we are going to learn today. Here's learning goals, right? We'll define chronic absence and why attendance is important. We'll explore trends in attendance, and Kari already spoke to some of those data trends, and we'll take a quick look at them again. We'll identify root causes of chronic absence, understand the connection between mental health and physical health and attendance. We'll take a look at the tiered interventions to better inform us how to address chronic absence, and then we'll identify strategy that you can incorporate in schools and communities. So let's go to the next slide. And why we believe that everybody is functioning on the same understanding that 10% is that number that makes a student chronically absent. So missing 10% of school for any reason creates that at-risk situation. And so we are concerned about students who accumulate 10% or more of missed school. And chronic absence as a measure includes excused, unexcused, and suspensions. So, and when we think about this, we think about it from that lens. And if we go to the next slide, we wanted to clarify how we think about these measures, right? We speak about average daily attendance and truancy or less of truancy and chronic absence. So as we think about what average daily attendance means, it's a school level measure that tells us how many students show up each day. It helps us notice when dips occur, but it masks individual student absences. Whereas we look at chronic absence, it emphasizes all, or it looks at all absences. And it emphasizes the impact of missed days and the benefit of being present. And it takes that problem-solving, proactive, trauma-sensitive strategy, and it really focuses on family and student engagement and deepening those relationships. If we go to the next slide, we wanted to just bring back to you or show why or how research looks at why attendance matters in our K-12 spaces. We know that attendance matters a lot, right? Not just for habit, but it's really helping students promote this lifelong success. And so students need to attend and engage in order to benefit. And while showing up does not guarantee learning, a student who misses class cannot benefit. And then if a large number of students misses class, it's an indication that those challenges, it requires systemic solutions. So we know from research that chronic absence in kindergarten and first grade can lead to inability to read at third grade. And that inability to read by third grade leads to lower academic achievement in middle school and potentially dropout in high school. On the flip side, on that positive side, Students who attend regularly in the early grades perform much better on measures of academic and social and emotional capacities. And then by third grade, they are successful they're proficient at reading. By middle school, they have passing grades. And in high school, that regular attendance translates in graduation from high school, and then really a good trajectory for college and career success. Next slide. So as we think about what Kari just shared in terms of the data and where we are around chronic absence data, we think about what's the national. And so we know that chronic absence doubled from 1 in 3 students pre-pandemic to 1 in 6 students in 21-22. And it slightly decreased after that. And then now it's approximately 1 in 4 students across the nation who are chronically absent. And chronic absence remains strongly associated with worse outcomes for achievement, graduation, and executive functioning. So as we just saw the previous slide, chronic absence impacts academics and so much more, right? We care so much more about their holistic development. And so let's take a look at more Connecticut data in the next slides, and I'm going to invite Kari to take us to these slides.
Thank you, Emma. So with these slides, we're going to dive a little bit deeper. We know now everyone has an idea with all the definitions, what chronic absence is, what the impact is for students, and we want to look at different groups of students and how they're doing with chronic absence. When looking at this table, the blue column is 21-22, which was our peak of the pandemic, and orange is just last year. And along the bottom, some of the labels didn't complete. So it's all students, went from 23.7 to 17.2. Students of color, the next one is eligible for free and reduced lunch data. Students with disabilities, and you can see these numbers are still much higher than other students. ELLs, ELL, and multilingual learners, and then our homeless our students who are have unstable housing are our highest group of students with chronic absence. So I wanted to share this with you so that you can look at this data in this perspective on EdSite, and on the EdSite monthly attendance dashboard, you can pull this data up for your district and your schools specifically. But our progress shows that targeted supports and engagement matter, while high need groups require even a deeper focus. So really, and we know that students who are both eligible for free and reduced lunch and maybe a student with disabilities even have higher chronic absence. So you can look at all of that in EdSite Secure and EdSite Public. Next slide. With this slide, we're looking at our grades. So we've seen improvement in attendance across nearly every grade. Kindergarten really has shown encouraging early gains. If you have any thoughts about that, you could share that in the chat. Elementary grades continue to have the strongest attendance, and this is comparing last year to just the year before. Middle school is showing steady improvement, and high school remains the biggest challenge, especially the senior year. And so lots of work is being done around career and pathways and academies and other ways to make high schools more engaging for students. So next steps would be to build on early successes while tackling this persistent high school absenteeism. This is our biggest challenge right here. Next slide. Any questions, please put them in the chat. This is a slide that we looked at by grade level again, but it's looking at last year's data. In the blue are students with disabilities, and orange are students, other students. And chronic absence, as you can see, is consistently higher for students with disabilities at every single grade level. Gaps are visible as early as kindergarten and widen significantly by middle and high school. Rates for students with disabilities climb steadily, peaking at over 1 in 3 students chronically absent by grades 9 through 12. Students without disabilities also show an upward trend in high school, but at much lower rates. And then the pattern highlights the compounding challenges students with disabilities face and the need for early sustained support across grades. So I was speaking with a district yesterday about a grade 12 couple of students who weren't coming to school. And what I talked to them about are those students in grade 6, 7, 8 who are not coming to school, and the need to get in front of that early so that when they get to ninth grade, they can be successful. Because if they're not in attendance and successful in ninth grade, you're going to have those students who choose not to come to school in grade 11 and 12. So you've got to get to this early in a preventative manner. Next slide, please. And I just want to talk a little bit about forecasting trends and plan interventions in advance. So chronic absence follows a predictable seasonal pattern every year, rising in the winter months and easing in the spring. In 24-25, however, it peaked in February, where other years it had peaked in December. But January and February this year really peaked to 20% in February. We had not seen 20% at all last year. So this mirrors doesn't, so we know that there were some things that were happening in January and February with a change in leadership and with immigration enforcement and fears, also foul weather, late start days, our bad attendance days, and a lot of illness. So we know that that if we know that attendance is going to be tough, then we can start our messaging around health and wellness and trust with families as early as September and October. And we had some really terrific mid-year recovery efforts in our district that help us to go from 20% in February to 17.2% in June. And so that works even at the student level. You know who those students are who were chronically absent last year. If a student is chronically absent the year before, it's likely they could be chronically absent now. And so you should look at the patterns of students being persistent chronically absent. Next slide,
Hey, Kari,
please.
can I jump in real quick?
Yep.
Looks like some folks have some questions about the previous slide with disabilities.
Yep.
Is that this one? So where it says students without with disabilities, is that all disabilities or ones that are qualified through a 504, IEP, or both?
This would be students with an IEP. It would not include students on a 504 plan. And if they have an IEP, they're included here.
Great, thank you.
Yep. And in EdSite, on EdSite, in both the secure and public, you can look at the distribution of chronic absence across the types of diagnosis a student might have. And that's very interesting to look at too at your district level. So you can really drill down and target who are those students that we can really help, who are at who are at tier 2, like who are at 10 to 20% chronically absent. Those are the students who really could use some tier 2 efforts. Okay. And then I explained that. So what stands out for you as you see these data trends? And I'm going to give this back to Emma.
Please share with us in the chat. Would appreciate hearing from you on the data trends. What might be the implications of what you've seen in terms of data? I see some responses. Thank you so much. Numbers are really high. Students with disabilities tend to have much higher chronic absence. Yes. Yep. I see. Paying attention to patterns and trends will really help us move the work forward because we will know how to act, how to intervene. I'm sorry. Yep. Yep. How disabled actually are most at risk for being chronically absent. Yep. I see some of the same themes here. Yep. Really paying attention to trends in schools, both schools and at the district level, right? Great. Thank you so much for your responses. How to support homeless students, concerned about students with disabilities. the need for schools to communicate with families, the importance of attendance and target as well. Yes, absolutely. Those are those universal strategies that matter so much for all students. Getting parents on board. It seems like deep engagement, collaboration, communication with families is also a theme in the chat. Wonderful. I want to keep us moving. And please feel free to continue commenting in the chat. We appreciate seeing all your answers. Let's go to the next slide. As we think about the data slides and what we've heard Kari say and how, what are the challenges and opportunities for us to move the work forward, we think about taking a hands-on approach. So when we think about key areas that would ensure that students not only get to school but stay engaged, we think of these positive conditions for learning. We know that students are more likely to attend regularly when school is physically and emotionally healthy and safe, when schools create a sense of belonging, connection, and support, when schools offer an academic challenge and engagement, and when school is made up of staff and students who have the well-being and the emotional competence to build the relationships that are really at the core of the positive conditions for learning. And then we know that chronic absence occurs when challenges in the community or in the school erode these positive conditions for learning. So as you think about these positive conditions for learning, think about having all of them activated in the schools for students to be at school and stay engaged so they can learn and succeed academically and socially, emotionally, and overall. And if we go to the next slide, we think about the fact that when multiple students miss school, the impact ripples, because chronic absence has this ripple effect, right? It affects individual students, and it can also affect other students in the classroom. It affects teachers who have to reteach, and if the levels of chronic absence are very high, it can affect the entire school. So what do we do about it? How do we start our work and how do we proceed? Well, we take a look at the root causes. What are the barriers? How do we know? How do we use this qualitative and quantitative data to learn about why students miss school? So at Attendance Works, we look at the root causes of chronic absence from these 4 perspectives: barriers, aversions, disengagement, and misconceptions. And you see that barriers and misconceptions are really big reasons for missing school from systemic perspective, right? We've got housing and food insecurity. We've got unpredictable schedules for learning, or lack of access to tech, or the impacts of trauma, or perhaps violence in the community. Those are big systemic challenges that impact student attendance. Aversions and disengagements are many times barriers that could be addressed within the school limits or boundaries. And so as we think about aversions, we've heard about anxiety, we've heard about perhaps undiagnosed disability or just the disability accommodations, unwelcoming school climate. Or for disengagement, we think about students who say they're bored, or there are no meaningful relationships to adults and peers in the school, or not enough or not at all after school activities or enrichment opportunities or academic and behavioral support. And so as we think about these categories along with misconceptions, right, how can we think about informing the parents, the community, the families, keeping those relationships deepened so that there is trust and that there is constant communication to clarify any misconceptions. Some people might think that missing 2 days a month does not affect learning. In fact, it does, because 2 days a month translates to that 10%, which qualifies as chronic absence, just like we talked about it before. So as you think about these root causes of chronic absence in the 4 areas, the barriers, aversions, disengagement, and misconceptions. If we go to the next slide, what have you seen or heard as the most common factors that affect attendance in your schools or in your districts, in your communities? If you could put that in the chat, we would really appreciate hearing from you. I saw a comment, missing the bus, anxiety disorders. And yes, Elliott will address a lot of that very soon in our next few slides. Illness, anxiety, I see these as a theme. Transportation comes up again in your comments. A walk to school, especially in bad weather. Yes, yes, yes. Thank you so much. Mental health, anxiety. Yep. Thank you so much for your comments. Really appreciate misconceptions about mental health, vacation, separation, anxiety, family stress, not recognized that they add up. Absolutely. Family challenges are always impacting. Homelessness, peer issues is huge across the board. I can learn at home, that perspective or approach. Yes. Not feeling safe. Yes, not seeing attendance as important because they're still passing class. Yes. So to answer that quickly as a comment, think about the experience that the student is missing, right? When they're not in school with peer learning and peer support and the teacher in front of them. No, right. Thank you so much. Keep putting your comments in the chat. We really appreciate seeing your answers. And for the sake of time, because I want to give Elliott space, I want to make sure that we move on to the next slide. So let me invite Elliott to take us to the next part of our session today.
Thank you so much. Thank you so much, Emma. And Kate and Kari, thank you again for having us. And after seeing all the responses in the chat, I think we're definitely going to be touching on some of those issues that many of you raised, which we're especially seeing post-COVID. All right, so on this slide, so we know that healthy learners start with a healthy student, but sadly, many of our kids are dealing with poorly controlled health issues, which can then influence whether they're going to be able to show up to school and stay healthy. And on this slide, you can see some of the more common health-related barriers to learning, like asthma and dental issues, vision problems, behavioral health. And historically, asthma and dental issues have been the leading contributors to missed school. And both are definitely more prevalent in poor socioeconomic areas, with dental caries being the most common chronic disease of childhood, 5 times as common as asthma, and contributes to roughly 2 million missed school days annually. But we know that it's preventable by getting kids connected to the right supports and resources. And children with poor oral health are nearly 3 times more likely to miss school than kids with good oral health. And then behavioral health issues, they affect about 20% of children, and we've only seen those numbers spike post-COVID. And due to stigma and barriers to access, many kids just don't receive the treatment that they need. So it's really no surprise when we see data that shows kids who are dealing with behavioral health issues are 2 times as likely to miss school. And if school is perceived as physically unsafe or emotionally unsafe, students may choose to avoid school altogether. And obviously anxiety is a prime example of this. And there was a recent blog that Dr. Pam Cantor, in collaboration with Attendance Works, we have it on our website. I'll make sure to share the chat at the end, but it goes into it talks about anxiety's impact on chronic absence and offers some things that schools can do to best support families and students who are dealing with anxiety. And I'll make sure to drop that in the chat. Okay, next slide. So youth risk behavior survey data shows that about 40% of students reported feeling sad or hopeless to the point where they stopped participating in their usual activities. And when you look at males to females, females significantly outnumbered males. And then over 2/3 of LGBTQ students reported similar concerns. And then this is all just compounded by the fact that, again, many students don't feel safe and connected. And the data shows that roughly half of students across the country said that they didn't feel connected to someone at their school. And if you compare Connecticut's data to the national, it is a little bit better, but obviously still concerning. And knowing this data, where does that leave motivation for our students to attend school? Next slide. There's also a really strong connection between mental health and academic performance. And data shows that students who report lower grades are at significantly higher risk of symptoms of suicidality and depression. And one statistic that should be keeping us all up at night is that kids who receive mostly D's and F's are 3.5 times, just over 3.5 times more likely to report attempting suicide as students who receive mostly A's. But on a positive note, we know that healthy students are more likely to attend school. They're more likely to stay engaged. They're more likely to be ready to learn. And they're also the same students who are going to be more likely to graduate and then go on to live healthier, more productive, fulfilling lives. Next slide. Okay, so please feel free to drop answers into the chat on this one. What are some of the existing foundational supports in your schools, and are there things that you feel are missing that could be supporting students and families to address some of these barriers and challenges? And Emma, if I missed something in the chat, please help me highlight it if you don't mind.
Yes, it might make sense to go to the next slide, and then we'll come back to this question. How about that? Just to clarify what we mean by foundational supports. So
Okay,
as we
perfect.
think, So as we think about, so what do we do about addressing chronic absence, right? We think about reducing a chronic absence really requiring to take this multi-tiered system support. And so as we think about tier 1, 2, and 3, we know that the tiers lay on the foundational supports. And so if you get the next slide, some of these foundational supports are positive relationships and healthy environments and access to tech, and definitely welcoming and a safe environment. And again, these are reflections of thoughts that you or systems that you probably have in place based on the chat, because these are some of the areas that you lifted. Thinking about activities to build community, learning supports, definitely thinking about cultural traditions and celebrations. And so as we think about the question that Elliott posed, if we go back 2 slides. Yeah. What are some of those foundational supports in your schools that you think are really critical in how you build on the attendance and really promote this as a priority? And I'm watching the chat. Elliott, you can join me in doing that.
Yeah, I see positive relationships, attendance meetings on a regular basis, enrichment activities.
Yep, I see
Community
tiered
building.
interventions. I see SAT meetings, RIT, open lines of communication. It speaks to that two-way communication with families. Yep, mentors, after-school activities. Yep, and we're getting into strategies, so that's really great. I see a really sweet segue here. So let's go to 2 or 3 slides over. Wonderful. Thank you, Kate. Some of these are reflected in your chat. Universal tier supports. These are some of those supports that you might already have in your schools, the ones that you would want to replicate and build on and deepen and refine. And some of these are clear, concise, and consistent communication about expectations, schedules, information that parents, families, students need to know, personalized, positive communication when students are absent, right? Not waiting for absences to add up, but really being proactive to notice when a student misses the very first absence, recognition of good and improved attendance, definitely connection to a caring adult in the school. And Elliott, why don't you take the health one?
Yeah, so thanks, Emma. So we've seen a lot of misunderstanding, especially as we went through COVID and coming back to school from COVID, about when it's appropriate to send your child to school, when you should stay home. So we've developed a resource in collaboration with the National Association for School Nurses and Kaiser Permanente that outlines some of those things, and we'll share that towards the end.
Mm-hmm. Absolutely. And if we go to the next slide, we wanted to introduce the attendance playbook. This is an amazing resource that you can have in your pocket, well, electronically or on paper, and it really unpacks what a tier 1, tier 2, and tier 3 interventions could look like. Each one that you see listed in a table of contents has research, has examples from a place in the US, has research associated with it, how it worked best. And so we really encourage you to take a look and to use this resource as a guide for how you do work. Great examples again. And the next slide, we wanted to, yes, I just dropped the link in the chat to the playbook. You can access it for free. Just click on the link in there. You can also scan the QR code that we listed in here. And we wanted to encourage you to check out at least one of the strategies, and we selected addressing asthma. So we'll encourage you to do that on your own time. I'd rather that we have these conversations. So I think it's a great resource to have, both accessed on your mobile device and on your computer. So you have both the QR code and the link to access that. And so it'll be interesting to see what you thought, perhaps as a follow-up to the session. But again, the attendance playbook is a great resource to have as an example of tiered strategies. And let's go to the next slide. Tier 2, this is where we intervene early, right? We take that proactive early intervention approach. And some of these strategies include a family visit. We know that LEAP is so strong and such a bright spot, such a an example of best practice implementation that has been shared in so many states. And so Connecticut is doing really great and has those home visits as very exemplary interventions. Mentoring is also a proven success for tier 2, check-in, check-out, expanded learning opportunities. Elliott, do you want to talk a little bit about the collaboration with the school nurse?
Yeah, absolutely. So especially when we're dealing with kids who have chronic health issues, the nurse can play a significant role in helping those students and families coordinate the care around those issues, making sure they have an asthma action plan on file, permission to use their medication at school, etc. And then also the importance of intervention, of providing opportunity for small group interventions and supports for students, especially those who may be dealing with some behavioral health issues or challenges. And I saw in the chat a suggestion to have teachers be that point of contact with and helping families get who they identify as having issue get connected to the social worker, to the counselor, and so on. So I think part of that comes with professional development for staff. And that may be more of a tier 1 based intervention, but I think it is especially important as we are seeing all of these different issues that sometimes go directly to where sometimes the teacher can help start that conversation and is that trusted partner with the parent and then can help them connect to the right resource.
Mm-hmm. Absolutely. So we wanted to give you the opportunity to share about your experience in seeing Tier 2 strategies successful. If we got the next slide, we would love to see that in the chat. What have you seen done successfully in terms of Tier 2? And what would you replicate at your sites if you saw something new, or if you were reminded of a strategy that was implemented well? Yep, I see home visits through the LEAP program, absolutely. Mm-hmm. Yes, those relational home visits make such a big difference. Parent communication, phone calls to families, absolutely. We just spoke with a district the other day whose superintendent is encouraging phone calls and not emails because of those immediate connections and clarification or clarity of communication. Parent communication, parent meetings, home communication, lots of two-way communication, and it sounds in the chat here. There's a question about what mentorship programs are available in Connecticut. Maybe that's something that we can explore with Kate and Kari. Check and connect mentoring programs. Bringing parents and families meetings to help support all of them. Yes, that holistic perspective is so important. Kari, did you want to make a comment?
Yeah, sure. I'd be happy to. We have a state lead for mentorship called the Connecticut, the Governor's Prevention Partnership, and they do trainings and help districts set up mentorship programs, school-based mentorship programs. It's a wonderful organization. If you haven't heard of it, the Governor's Prevention Partnership. And my chat is not working. I don't know why, but I'm not getting updates. So I would have put it in the chat, but I just wanted to give that information.
Appreciate that, Kari. Thank you.
I just put the link to the Governor's Prevention Partnership in the chat. Another place to look is sometimes your local youth service bureaus will also have mentoring programs, or may be interested in starting one locally.
Wonderful. And we see so many more comments in the chat about skills group. Lunch buddies are great. Peer mentors with older students from our other schools who are positive peer models. Peer mentoring is so important and so powerful. Offer support for parents, not just for students. Phone calls. See a theme here. We have a daily check-in group with students who are identified as chronically absent. Relationship building is the emphasis. Absolutely. Thanks for sharing. Check-ins with the preferred staff. Absolutely. That connection with an adult, a caring adult in the building are so critical to how students feel that sense of belonging and connection and support. If you remember, that's one of the positive conditions for learning. Also connected to that, health and safety, feeling safe, getting to school and in school, right? Wonderful comments. Thank you so much for all your comments. Wonderful. Let's go to the next slide. We have tier 2 as well, tier 3 as well. So these are the most intensive interventions, right? That's when we engage many times with partners outside of our schools or outside of our districts to support the needs that we at times cannot address. So housing stability support, student attendance review board, individualized learning and success planning, and Elliott, do you want to speak about collaboration with health professionals?
Yeah, thanks, Emma. So there are opportunities to collaborate with local providers, local health institutions. We saw, especially post-COVID, significant number of partnerships with behavioral health organizations who are able to come into schools and provide those tier 3 supports, individual supports to students. That then allows the school staff to have a partner that they can then collaborate with and refer kids to when they identify a student who may need additional supports. And we also have seen many places use telemedicine to be able to get those tier 3 supports in place, especially in places where there may be challenges or barriers to getting a direct connection.
Mm-hmm. Yeah. What have you seen done well for tier 3? We know that some of your students fall into that tier. If we got the next slide. And again, please share in the chat. How effective have they been, those tier 3 interventions? Thanks, Kate. Share the love for check-ins. Yes. Deep has, sorry, being fast, trying to keep up with the chat. Let's see. Social work services have been useful, but progress often takes time. Yes. DCF, District Attendance Review Board. They've been hit or miss. Tier 3 interventions tend to work, but require the most time. Absolutely. It requires the most intervention. It's the most expensive, right? In terms of finances and staff time or capacity. I see referrals to 211, youth and family services, yeah, mental health supports in the community. Yep, the one-on-one support, most intensive, yes. District Attendance Committee that meets once a month. Partners with 2 local community organizations, yep. Referrals, supports from partners, so critical to getting this work done. I agree. Keep your comments coming. Really appreciate them. There's a question here. Can we talk about DCF? Sometimes we have exhausted all avenues and we can call, but nothing gets done. I'm not sure, Kari, if that's something that we can address.
Yes, I can talk about that quickly. We are going to have that topic on Talk Tuesday in October. So we will have DCF there to talk about when and when not to make an education referral for educational neglect. But generally, it's if the family is neglecting the child, it's not just not sending them to school. There needs to be something else happening where the child is being neglected or abused. They generally will take students who are under age 12. If they're over 12, it's considered a truancy case. But you should always refer if you have a gut feeling that you want to make a referral. You can also contact them to discuss, if a referral needs to be made. And so I can put a link in the chat to our last DCF presentation last year. We always had them on Talk Tuesdays.
And somebody asked about Talk Tuesday topics, maybe a link to the Talk Tuesdays as well.
Yes. Okay, we'll do. Thanks.
Yep.
I'm gonna
Thanks, Barry.
jump in real quick. For some reason, my camera's not working. I apologize for that. But another area to look for a connection is with mobile crisis. Mobile crisis has the ability to do those home visits and to, start at 6:30 in the morning, show up at somebody's house and try and get that routine going in the morning. So that is another area that I know folks don't always think of. because you think mobile crisis is, self-harm, suicidal ideation, but they're really there to support anything that may be considered a crisis situation, which attendance absolutely is. I know that some folks had questions about examples of attendance interventions in IEPs. I can speak a little to that in my own experience, and Emma and Elliott, I'm not sure if you have some advice as well. I think really it's looking at the root cause of the attendance and addressing that through, it could be a goal, whether it's, self-advocacy, if it's a social situation, increasing those social skills, but then also looking at it, potentially there's a reward for making a certain goal with attendance. I understand, I worked in high school, that gets harder the older you get, because finding those motivations is tougher for the older kids. But Emma and Elliott, I'm not sure if you have anything you want to speak to in terms of that in regards to an IEP.
Sorry, I was on mute. Yeah, absolutely. So, as a provider, who had practiced in a private practice setting for many years and then saw kids through the mobile clinic program, we obviously had many kids who we identified who may not have been picked up on, or maybe the parent didn't know how to seek out such support. So I think when it comes to IEPs and 504s or any type of health plan support, I think there needs to be coordination and collaboration, and that requires input from a healthcare provider, input from parent, input from school, and making sure that there are measures in place to be able to share that information in a obviously a private, secure way, but making sure that specific need-to-know individuals have access and can best support that student, no matter what type of support they're receiving. I think coordination and collaboration go a long ways in implementing supports for our students. And sometimes it may be a specific individual who picks up on it, and we just need to make sure that that individual can now connect with the necessary supports or individuals in the school to get that kid the supports they need.
Yeah.
And families struggle sometimes to navigate through that process. And so having that team-based approach, I think, can make a huge difference.
Yeah, thanks, Elliott. Thanks so much. Lots of comments around this. Thank you so much. Keep them coming. If there are lingering questions that we didn't answer, we probably could get the chat and follow up afterwards. Let's move on. And I'm going to invite Elliott to take us away to aligning interventions to reasons for absences.
Thank you, Emma. Can we skip to the next slide, please? There we go. Perfect. Thank you. All right. So improving attendance really requires that we're using evidence-based interventions, and we've talked about some of those, but it starts with the whole child approach, and you can see the diagram on the right. We talk a lot about health services, but that is one of 10 components of the whole child model. And we need to make sure that we're addressing each of those 10 components, because in one way or another, they all impact a child's attendance and learning environment. We have to make sure that foundational supports are in place, like policies around school climate and connectedness. We need to make sure that we're prioritizing health and physical education, screenings, and we have to also make sure that we're collecting health data and sharing it with specific need-to-know individuals in a secure way. And Medicaid and health insurance plans, and I'll talk about this a little bit later, they also have a role in supporting evidence school-based health services. And we need to leverage those Medicaid dollars to be able to do this work. Every school should have a school nurse. And as health experts in the school setting, school nurses coordinate the student health needs, and they've been proven to keep kids in class. If you remember your school nurse from your elementary school years, please throw a comment in the chat. I definitely remember mine and was lucky enough to have one. And then school-based health centers, of course, also keep kids in school, providing full comprehensive services on site at the school. But just because you have a school-based health center, that doesn't mean that you don't need a school nurse. They perform separate but complementary roles. And we obviously talked about behavioral health supports, which are especially necessary. We need to also focus on creating trauma-informed schools so that we can recognize and respond more quickly, and that'll lead to reduced suspensions and improved attendance and overall school performance. And then I'm biased, of course, but school health physicians can also play a tremendous role in supporting schools and districts in this work and serving as liaisons to providers in the community. And then other best practices are employee wellness, which is one of those 10 components of the whole child model, community schools, home visits, which you guys are doing amazing work with, after school programming, such as arts or athletics. Boston Public Schools showed that kids who participate in the arts have improved attendance. And so making those things available, but also helping families to overcome the barriers to allow their kids to participate. And I can't leave here without, or give a presentation without throwing in a dad joke. So feel free to drop your answer into the chat. But does anyone know why the oboe's favorite place is the library? And you can throw that answer in the chat, and I'll give you the answer at the end if it doesn't get guessed between now and then. Okay, next slide. All right, so here's a little bit of trivia. And you can throw your answer into the chat. Traditionally, the role of the school nurse was designed to promote education achievement by promoting student attendance. In 1902, so 123 years ago, Lena Rogers was appointed the first school nurse. Her early success in reducing absenteeism led to the hiring of 12 more nurses, and within 1 year, medical exclusion decreased by what percentage? And please throw your response into the chat and we'll see what kind of answers we see. And I see somebody already got the answer to the dad joke. Woohoo! All right, I'm scrolling through the responses. I see some 55s. I see some 40s. 79. Okay. Let's see. All right. Okay. I don't know if anyone gave this answer, but believe it or not, the answer is E, 99%. So if that doesn't make the case for a school nurse, I'm not really sure what does. And if somebody gave that answer, I'm sorry if I missed it. I tried to scroll through really quick. I mentioned earlier the role that a school nurse plays, and we continue to advocate for a school nurse in every school. And obviously, many times it's that school nurse who may be the first person to identify the behavioral health issue and then can make that direct handoff to a social worker or a counselor or behavioral health support inside the school. And it's also especially important that school nurses, social workers, counselors, have a very, very close working relationship so that they can support each other, provide the best supports to our students and families. And we'll talk about attendance teams a little bit towards the end. Okay, next slide. So I'm going to try to share this story as quickly as I can. When I was at the district, the program still actually exists. So between a partnership from the health department, local health department, and Vision to Learn and the district, we did vision screenings for our kids. And any child that didn't pass the initial vision screening from the health department was then referred to Vision to Learn, who would then come into the school and do a more thorough eye exam. And then provide free glasses to kids who needed them. And when we looked at our data after the first year, we found that 50% of kids who failed that initial screening from the health department were never seen by Vision to Learn. And so that left 50% of kids who potentially needed glasses unseen. And what we found out was that it was because the consent never made it back. So whether it was lost on the way home, whether it was lost on the way back to school, whether the child was embarrassed about wearing glasses and never took it home, whether it ended up on a teacher's desk somewhere, the challenges in the barrier, or maybe there was a translation issue, or maybe a literacy issue. No matter the reason, I mean, there are so many different barriers and challenges, right? So what we explored was the idea of going from an opt-in to an opt-out process. And we learned that Vision to Learn had done that with other large districts in other states. And so we worked with our legal departments, 3 legal departments, and it took us about a year and a half until we were able to get the approval to proceed. And when we moved from an opt-in, a signature required from parent, to an opt-out, a letter that goes home and says, if you don't want your child to participate, send this back. We went from 50% of kids getting glasses who needed them to 98% of kids getting glasses. And I'm not sharing that to brag, okay? I'm sharing that because sometimes we put in place these unintentional barriers that we don't necessarily think about that only further create barriers and challenges for our families. And so as much as we can, we need to go back and look at our policies and procedures to make sure that we are, when we're doing things, that we're doing it in the best way possible to allow our kids and families to take advantage of available supports and services. Yeah, all right. So next slide. And if you have any questions about that program, please don't hesitate to reach out, and I'd be happy to share more information. So obviously schools can't do this work alone. We really need to make sure that we align the intervention to the reason and then find the right partner to address it. And we have to first have the right infrastructure in place to make that partnership successful. And that really includes information sharing agreements to help ensure coordination of care. If we make a referral, did we close the loop on connecting the student family with the service? It's easy to give a referral, but many times the family isn't able to follow through or get connected. And so we need to be on top of that and help families to overcome some of those challenges. And then we also, and in terms of information sharing, there is now a amazing resource that was developed by the American Academy of Pediatrics and the National Association for School Nurses on that two-way information sharing. And I can put the link into the chat and we'll share it afterwards. And there is actually a template that can be used by schools and districts to help address that, the FERPA and HIPAA issues around information sharing. And then we also have to make sure that the interventions are readily accessible. I talked about the challenge with vision screenings and getting glasses. Obviously, that's just one example. And so, that piece of aligning intervention to the reason, to the partner is especially important if we're to do this work successfully. Next slide. All right, so what successful health interventions have you seen in your districts? And again, feel free to drop into the chat. What are some gaps that you're seeing in your health-related intervention? And we'll try to go through some of the responses. I see a question about what does social determinants of health mean? So thank you for that. So it could be housing insecurity, it could be food insecurity, it could be transportation challenges, it could be access to healthcare supports. Like if you look at many inner cities, there are significant health professional shortage areas, meaning that there aren't enough healthcare providers for that population. And so as social determinants are very common reason why our kids are not showing up to school or getting the necessary supports that they need to stay healthy and in school. And so by screening for those things, we can then help better identify who are the kids at risk and then work to get them connected to the right supports.
And one of the things that we know is that Connecticut has nurses in each school, right? Or at least schools share a nurse. And that's great to see some of these comments really partnering with the nurse to connect kids to the appropriate resources and needs. And
Yeah, yeah, absolutely.
Mm-hmm. Mm-hmm.
I also see dental come up, different health services come up. Dental, there are many programs out there where they bring services directly to the school and do checkups and do comprehensive care. We've seen many programs through local health departments or even other partners bring vaccinations to school. At the district, we had the local health department when I was at Detroit Public Schools. We had the local health department coming in and giving, and they still do, giving vaccinations to kids, but capacity was limited. So we went and became a vaccine for children provider. And we were able to then use our own staff to go out to schools to give vaccines in complementing the work that the local health department was doing. Not every district has the supports and means to do that, but that's where you work with local partners to be able to bring in those services if you can't provide them directly. So,
Mm-hmm.
yeah. Okay. And please continue to drop stuff into the chat. And again, if you have any questions in the space, please don't hesitate to reach out. Okay, next slide. So on this slide, this is just really reinforcing the importance of collecting data and having a system in place that allows you to collect health data on students. There are student information systems that are now building out health sections where you can document certain things. Many schools we're seeing partner with student electronic health record systems or even have read-only access to local health institution electronic health records so that nurses, social workers can go in and see if a child was seen for a recent health issue. And then we also want to make sure that we're not just capturing whether it's an excused or unexcused absence. If we can actually pinpoint the reason for the absence, then we can better identify the issues that our children are dealing with and then help make sure that we're providing the appropriate resources and staff, resources and supports. And this is just one example of PowerSchool on the screen at our local local school district where they built in reasons for absences, and then you can't actually proceed until you put in an explanation of why you chose that reason. So, which then gives us better data to, again, provide the necessary supports. Okay, next slide. So many organizations are also engaging in messaging around making attendance a vital sign. And when a child visits a doctor, vital signs are the first thing we check. If they're normal, we provide reassurance. If they're outside of normal, then we dig a little further and figure out what the cause is and then provide the necessary support or intervention. And knowing the connection between health and attendance really needs to be included as a vital sign. Is it a health issue? Is there an underlying social determinant of health? Is something happening or not happening at school or in the child's home? Is there an intervention that we could be providing to help get the child overcome that specific issue and get them back to class? And a recent All In for Attendance Summit that was hosted by Johns Hopkins in collaboration with Kaiser and Attendance Works brought leaders from health, education, public health sectors together to address chronic absence. And as part of that summit, a white paper was released that highlights the use of school attendance data as a vital sign of student and system well-being. And I'll make sure to drop that link into the chat in case for those who are interested in reading it. Next slide. And, as we talked about, schools cannot do this work alone. It really requires collaboration between partners, health institutions, health departments, community partners. Health plans, of course, play a role. In Missouri, they developed a collaboration where school nurses are connected with resources offered by the Medicaid plans, including things like case management, which then can help further support families and students. And we talked a bit about the whole child model, parent engagement, building trust with our parents is especially important. And of course, we cannot forget the voice of our students who play a huge role in this work. We need to listen to their voice if we are to implement certain things and supports. Next slide. So as you begin to think about, things that you can put into place, or you're probably already doing many of these things, we have these 4 focus areas, proposed immediate actions that will soon be released in a toolkit that Johns Hopkins is leading in collaboration with Attendance Works. And it really starts with prevention, including supporting relationships and healthy routines and habits at home and at school, maximizing access to school-based health screenings. We talked about vision, dental, behavioral health, vaccines, food and housing supports, screening families for food and housing insecurity. It includes messaging on the importance of attendance routine, when a child should or shouldn't stay home. We saw families struggle a lot with this during the pandemic, keeping kids home unnecessarily. And so we want to make sure that our messaging is evidence-based and then also available in necessary translations. And it also includes knowing the student body health needs, gathering that information, and how those issues might be creating barriers to attendance, making sure that those students with chronic health issues and disabilities have those individualized health and education plans that we talked about earlier, so that families can then feel secure sending their kids to school. And it also includes making sure attendance teams draw on different areas of expertise, including school health team members, such as the school nurse, the social worker, allowing for early identification of health issues and then better coordination of care. Next slide. So in collaboration with the National Association of School Nurses and Kaiser Permanente, we developed multiple resources which can help put some of those 4 priority actions into place, offering guidance on how to keep children healthy and in school, when or when not to keep a child home, how to identify and respond to a child who's dealing with anxiety. And they're all available on our website, and they can be shared in multiple ways through back-to-school packets, parent and staff meetings. And you're also welcome to put your logo on it. There's just a process that you need to follow on our website. And if you have any questions regarding these resources, again, please don't hesitate to reach out. Next slide. And then I'm super excited to share our most recent chronic health conditions resource that just literally went live yesterday. This handout includes tips to help schools, districts, families help support and create a safe learning environment for kids with chronic health issues. And knowing that over 40% of school-aged kids, youth, experience a chronic health condition, it's really important that schools partner with families and healthcare providers to make sure they get the right support so they can stay healthy and in school. And both of these handouts are endorsed by the National Association for School Nurses and, again, are available on our website. And then do we have time for this, Emma? I know I probably went over on time.
Yeah, we can take a few minutes and just get people's responses to this.
Awesome. So again, feel free to drop into the chat, some thoughts on who can send messaging about the value of attendance, as well as when or when not to show up to school. What are ways that you can see being able to get these messages out to your families and community?
I see anyone and all staff. Admin and nurse, social workers.
Awesome. Yeah. I like the greeting upon arrival. That's great.
Mm-hmm.
Newsletter. Yep. Back to school nights. Great. Awesome. Someone mentioned the town. Yes, you can work with local, vendors. You can have grocery stores supporting the importance of showing up to school. You can talk to barbers. There's so many opportunities there. Yeah. Yeah. Awesome. Love it. Thank you, everyone. Keep dropping into the chat. So if we have a few, if we can go to the next slide, please. And then, Kate, can you help us play this video? We still have time for this, right, Emma?
I
Yes.
just wanted to check because we have 8 minutes
sorry.
left.
We have 8 minutes
That,
left. Okay. It's a little over 2 minutes. So
I wonder if, just in the interest of time, if people have questions, we share that in the chat, maybe the link, and folks can watch that later if they'd like, or I can send it out with the recording. If that makes sense.
Absolutely.
Sounds perfect. Yeah, and just to kind of give a brief overview, it basically just shows the attendance team in action and highlights the role of certain individuals like a social worker, like a school nurse, and the role that they can play as part of the attendance team.
Mm-hmm. Yep. And after the video, we had that question just as a reflection about acknowledging the fact that you have district attendance teams and school-based attendance teams. And so thinking about how is health included in that team that addresses attendance. Or a very reflection. If you put in the chat if you'd like, we always love to hear from you. We are at the end of our presentation, and so we wanted to really give you a chance for comments, reflections, questions. Especially we have Elliott Attisha, who's a pediatrician by trade. I don't know that he said that. He's our health fellow. And so this is your chance to pick his brain and ask a little bit more specific questions if you'd like.
I want to jump in for a second. There was
Please.
a question in the chat, and I know Kari's been having some trouble with her chat, but somebody was asking if the state of Connecticut provides any funding to help districts tackle attendance challenges.
Yes, Connecticut has funded the Learner Engagement and Attendance Program in 25 of our districts that have the most students who are chronically absent. And we also, and that's where the funding is for LEAP, but we also provide training to other districts around the LEAP home visiting. I mentioned that before. So anyone can come and train their staff. Or it's really learn how to talk to parents in a supportive way versus a punitive way. I also encourage you to think about your Title IV, and IDA funds are also used for attendance in some districts. But right now, the Learner Engagement Attendance Program is used for our funding for to provide a Tier 2 intervention. There's 25 districts.
Okay, thank you, Kari.
Yeah.
My chat. So someone had asked what the best way to get 2-in-1 involved with attendance challenges. You can. I apologize. My camera isn't working right now either. I have a weird request to re-sign into Teams, but I am worried that will shut this whole thing down. So we're just going to go with it. If you preemptively call 2-in-1 and say, "Hey, we want to set up a meeting with our mobile crisis provider to talk about how they can help, how their agency can help support." I can also send out, when I send out the information, a list of who all the different agencies are that provide mobile crisis services for different regions around the state. So I would suggest preemptively calling them about how you can partner together.
There's another question about sending a link for the home visit training. I'm assuming that's the LEAP. So we can share that as well.
All of these links for Talk Tuesday, and I'm so sorry I don't have access to chat to drop things in. It's frustrating, but in the Connecticut resources slide, and everybody will receive the slides, there's a link to Talk Tuesdays. There's a link to the Learner Engagement Attendance Program where you can sign up for LEAP 101. And there's also the School is Better with You, which also has a handout that's very handy given Dr. Attisha's presentation called When is Sick Too Sick for School? That's very family friendly. And so I encourage you to take a look at those links. They are provided in that slide on Connecticut resources.
Somebody had asked what IDEA stands for. That's the Individuals with Disabilities Act. So that is funding for students receiving special education services. And Title IV is one of the federal entitlement grants. I actually oversee Title IV-A. So if you do have questions about how to sort of advocate for that, for using that in your districts, please feel free to reach out.
Mm-hmm.
And I just dropped the link to the All In for Attendance Johns Hopkins Summit. There's a link to the white paper within that website. So.
Elliott, there's a question, too sick for school, is fever or vomiting 24 hours?
Yeah, so we talk about that. Thank you for raising that. We talk about that in our How Sick is Too Sick. There is guidance in there in terms of what to do regarding vomiting, what to do regarding fever. But I think the most important thing is that you check with your local health department to see what the current guidance is before you share that specific document. We just don't want to create any confusion for our parents and families. And if the guidance is different at your local health department, then just this document can be used almost as a conversation starter, just to make sure that existing guidance is current, that it's based on best practice. When we built this document resource, we actually seeked out input from school health experts across the country. We also reviewed the American Academy of Pediatrics Infectious Disease Manual in Schools. And so everything in that resource is evidence-based. But again, we want to make sure that it does not conflict with your local guidance so that we don't create confusion for our families.
If I can just add to that when this guidance came out, we made our guidance at the same time of when the sick, too sick for school, because it is different in Connecticut. It is 24 hours. And so that's why we have Connecticut's own when is sick, too sick for school. Everything else on the attendance works is perfect and wonderful. And I don't want to discourage using that, but you do need to be clear that in Connecticut, it is 24 hours.
And I know we're out of time, so I want to turn it back to Kate. And again, if there are any follow-up questions for us, for the Attendance Works team, we'll be glad to follow up in email to respond to those questions. And if they're specifically to Connecticut, you've got your experts, Kate and Kari, here to support you as you move attendance. And so thank you so much. We're so pleased to have had this opportunity to speak with you and hear from you and chat, and certainly hope for a great rest of the school year. Kate, back to you.
Yes, thank you so much, Ellie and Emma, for sharing your expertise, and for Kari for being such a great champion for attendance in Connecticut. I'm